Okay, this is a very big room and there aren't that many people in it. I apologise, some of the slides for you at the back, you probably won't see some of the smaller text on it, but hopefully you'll get a big picture and I'll try and talk you through it anyway. So hopefully you all had a nice lunch and you're not too asleep. I'll try not to put you to sleep if I can help it. As Chris said, I run a small consulting firm, it's me, called Kane Consulting. Prior to that, I spent a lot of time in the IT and telecoms industry, working for the likes of BT and Vodafone. I was one of the founder members of Vodafone's mHealth team. And during my time at Vodafone in particular, I became aware that there's some issues around mHealth. So whilst we might think that mHealth is actually going to be fabulously impactful, and there's a lot of potential there, working from this rather gross assumption that everyone's got a mobile phone these days, therefore we can get to them on the mobile and they'll be happy for us to do that and somehow improve health outcomes. It hasn't always worked out that way. And in terms of adoption, we've seen very different rates of adoption around the world. Traditionally, the UK has been a laggard, which is a shame because we're great inventors and creators, but we haven't done so well in terms of adoption and implementation. And in fact, during my time, most of my work was spent either in Africa or in the United States, almost at different ends of the spectrum in terms of the way they were deploying mHealth, but certainly more rapid in terms of adoption because they saw the necessity and they found very pronounced drivers. So we'll look a little bit about some of the reasons why mHealth might not be adopted. What I have done is I've tried to codify what I think are the predictors of success around mHealth programs and put them into a fairly simple methodology. We haven't got time to go through it all today, so I'm going to show you some excerpts from it and I'm going to show you some real-life examples to hopefully make it more concrete in terms of why these factors matter. So if that's okay, I'll carry on. When I looked at it, so I left Vodafone and I sort of sat in my chair and thought, what am I going to do now? I started to look across the history of the programs I'd worked on, and I also looked at programs that other people had worked on. And there's quite a lot of data out there if you look hard enough for it. It's not always that easy to find, but John Hopkins, for example, have a great database called mHealth Evidence, and if you haven't looked it up, do check it out for yourself. But there seems to be some common themes that were coming through, areas where projects had fallen down. And so I said, yeah, that does make sense to me. And then if I think about turning that into the positives, what are the things that we should do so that we can get some repeated success at scale? And I think what's interesting here, if you look at that flow diagram there, and I'll go into a little bit more detail to flesh it out, because it does look rather generic. It also looks rather common sense, I think. You know, shouldn't you be doing that anyway? Isn't that really obvious that you would do those things in any project, whether it was technology-based or whatever it was? Well, it seems it's not obvious in the world of mHealth. Not quite sure why that is, but I think there is a tendency for people to get seduced by the technology and actually step in here. So they've seen an app, or they've seen a gizmo, or they've seen the latest mobile phone and say, oh, couldn't we do something with that? So they're ignoring all this important stuff around here. Or even they're getting into the design phase too early and thinking about, why don't we do a game for this? Well, why do you need a game and who's it for? What's the problem that you're trying to address? So I actually think the sequence here is really, really important, and hopefully I'll demonstrate that. The other thing I would say is that it isn't really adequate to just start off on a wing and a prayer and do one of these stages at a time and forget about the rest. Really, you have to do all of these at the outset. But that doesn't need to be scary, because if you've got a well thought through proposal, you can check this off. It's really a checklisting in a way. You can check it off in a few hours if you're really on top of the programme, or certainly a day or two. So it's not like it's a very long sequential process. that needs to be gone through. But I would suggest that if you don't know how you're going to address each of those areas at the outset of the programme, then the chances are you'll find it difficult to retrofit and you will probably fail. Okay, so if I start on step one, first of all, is there a viable opportunity? That means, is there a real problem that we're trying to address? And I'll go into that a little bit more depth. Are there actually people who've expressed the problem? So, you know, who are these people who said, wow, if I only had a game, I'd really be able to sort out my diabetes? So are we listening to the real users of whatever solution it is we're trying to devise? And is it actually worth something? And I think that's one of the issues that we have, is that sometimes people say, well, you know, diabetes is a huge problem and it costs the health system billions. So we need to fix diabetes. Well, you're probably not going to fix diabetes in one hit with one mobile health solution, are you? And then if you cut it back and you do something that's not impactful, then you haven't actually generated any value at all. Why are you doing it? You know, again, are you doing it because you're building a business, or are you doing it for some sort of reputational boost? Are you doing it to be charitable? These are all questions that matter because it may affect the long-term viability. Do we have an outline solution? The tool I would recommend there is a tool called the Business Model Canvas. I don't know how many of you are already familiar with it. Anyone who's been through business school would have. And it's really a great single sheet method of summarising. Effectively, it's used for building new businesses, but it could be used for building anything that's new. And it looks at what's the value proposition, who are the customers, what are the channels for distribution, what are the costs, what are the revenues, those sort of important questions. Channels is often a crucial factor around mHealth programs. So we've got the classic situation with 100,000 apps on the app stores, and people think, well, I've got a great channel, I'm on the app stores. You know, everyone sees the app stores. Actually, it's a very inefficient channel for promoting a solution, because discovery is probably the least likely thing that's going to happen. So you need to think about those aspects. And also, does it pass the basic viability test? By which I mean, you know, is it cheaper? Is it obviously better? Or is it the only game in town? And in some parts of the world, mobile is the only game in town. If it doesn't pass those, then I'd be suspicious. So, are there real problems? Now, these are examples of real problems. Not trivial things. So, for example, I'll give you I'm going to move on now. You know, if I've got a situation where I've got drugs, they're not actually getting to the patients, that is a real problem. Could mHealth help me do something about that? Let me show you an example. So this is from a project in Tanzania called SMS for Life. I don't know if anyone has heard of it. Malaria is a huge problem across Africa, across Asia as well. It affects a lot of people each year, and actually there's still a lot of mortality associated with it. Novartis were providing very cheap malaria drugs. They weren't getting to the real needed, the users, the patients who needed them, because they couldn't manage them. And they're not going to put an SAP system into Africa. There's no infrastructure, it's just not going to happen. So we devised a very simple SMS basis for clinic workers to send in their stock counts on a weekly basis. So literally use a basic mobile phone. That enabled the district and regional medical officers to see where the stocks were. So we overlaid the stock counts on Google Maps. And then they were able to see, well, that clinic there has just run out, but I can see that the clinic 10 kilometres away has got some stock. They send a guy on a motorbike out, they ring him up, say, go over there, take some stock over to clinic B. And that was as simple as it worked. And that effectively reduced the stock counts dramatically. And it was one of the first national rollouts of an mHealth programme. And I think the fact that it was a real problem and it was a very simple design really contributed to the success of that. So I'll move on. Step 2, and I will speed up in the interest of time. Do we know who all the stakeholders are, is the first question. And do they all win? And if we fail on either of those, then probably the project fails as well. And getting to who all the stakeholders are is incredibly difficult, because I think everyone in health has a bit of a silo mentality. So if you're a doctor, dare I say, you tend to think the stakeholders are the doctors. If you're a nurse, you might think, and so on. Patients tend to get overlooked quite a lot. Also patients' carers, who are very involved in the delivery of health. So first of all, tease out who all the relevant stakeholders are, which can be quite a tricky exercise. And then make sure they all get a win. Because if you devise something that's fantastic for patients, that's going to incur a lot of extra work for the doctor, say, guess what? He's not going to be very interested. And so think about who all those stakeholders might be, and do they all get a win? And this is an example of a project that we did with Baxter. And it was the idea of moving a treatment delivery clinic into a home care setting. And it was quite tricky, really, because you've got a number of disparate agendas here. But it brings us on to the theme of what is the job that the stakeholder's trying to do. So in this case, what was interesting, previously patients had been doing paper diaries. They were bringing them into the clinic, so that was recording their symptoms, anything of that nature, in between, and some measurements, some vital signs, in between clinic trips. And then bring them in. And guess what? It was the nurse, the specialist nurse in the clinic was expected to transcribe those paper diaries and key them into a system. Well, that's not really what nurses want to be doing. So in devising something that supported the patient through treating themselves safely and being monitored at home, it actually freed up the nurse's time. So they then brought into the system. Similarly for the pharmacist, it enabled traceability of what was a very expensive treatment, actually. So it's important to think across all the stakeholders. If one of them loses, I guarantee they will want to bring the system down. Sustainable business models. So some people don't really like talking about business models, but I do think it's fundamental that the solution should pay its way over the long term. If you were to rely on donor funding or a pilot or a grant from that type of thing, it will only go so far. So when you get to rollout and you say, right, well, the pilot seemed to work, so let's go and roll it out. If you haven't got the business model defined up front, you're probably going to find it very difficult. And actually, you should be looking for the scale out to reduce the unit cost. Now, if in scale out you've lost your donor funding and you have no other form of funding, you've actually increased your unit cost, which is something that people overlook. And that's why a lot of programs have ended straight after the pilot stage, because they hadn't thought this through at the beginning. And in terms of who would pay for a service, there's quite a few options, really. And some of the way you can get people to pay are potentially controversial and radical. So I've got things like ad funding and data funding here. Now that's probably not very acceptable in a country like the UK, but in Africa, for example, it would be highly acceptable because people accept this, you don't get anything for nothing. There are a number of models that can work, and it certainly can be a sponsored deal from a supplier, but you have to think about who are the payers, how much would they be prepared to pay from the outset. Clearly, something that's designed is very expensive and there's no available payer. Patients are probably the most difficult ones to get to pay for any service, by the way. But here's an example of one that works very well, and it's quite happily funded by Walgreens, who are a very big pharmacy chain in the USA, because it generates so much business for them. So they created a Walgreens app. It's very simple. It does a couple of things that I think are service-oriented. I mean, apart from having details of where the nearest Walgreens pharmacy is, it does a couple of things. One is you can program in pill reminders. Fine. That's sort of in their interest because then you use your medication and refill it. It's got this very neat thing called Refill RX by Scan. So you literally, with your smartphone, scan the barcode of the medicine, and that creates a repeat prescription request. Obviously, if the repeat's on file with them, and guess what? It's waiting for you. And they generate a very big proportion of their repeat requests now this way. So that little app is now generating some billions of revenue for Walgreens every year. It's probably the most revenue successful mHealth solution in the world. So they had their eye on the money. Okay, design for success. So we sort of got through the preliminaries and we've got a viable target, we know who the stakeholders are, and we think we've got a business model. And now it gets quite heavy because we're looking at what are we going to offer. And so we start with the core functionality here. Now obviously there's a lot you could offer in an mHealth service. You could be offering education, you could be trying to take measurements, you could be offering adherence support, reminders, gamification, the list goes on, social, and so on. It's probably a good idea not to try and offer everything at once. And I think the essence of it should be, have we kept it as simple as possible? So relating back to the problem that we defined, relating back to the jobs that the stakeholders are trying to do, have we aligned that in as simple a way as possible? Because it's fairly fatal to have an mHealth solution that needs a big manual or needs a lot of training. It should really work straight out of the box. That's the expectation with mobile. And I'm going to move on to an example that I think that demonstrates that. Here's another one. Does it support existing pathways? So in the world of technology, and mobile especially, we love to talk about disruption. So we look at an app like Uber, which is disrupting the world of taxis. And it's actually quite controversial wherever they go. You know, local taxi drivers hate it, etc., etc. So technologists and startup visitors like disruption. Actually, clinicians don't. They're sort of thinking, I don't really want disruption. That sounds like we might be doing something risky. Upsetting the apple cart is evidence-based and so on. So actually, supporting existing pathways is a pretty good idea if you're designing for success. And also, have we thought about that planning for scale? So this is where we look at the areas like risk assessment, validation, regulatory approval. And it's been touched on a couple of times today. Sometimes in the world of mHealth, you are going into quite risky areas. You know, so it's almost like the mHealth solution is becoming an intervention, or it's maybe got some calculations built into it. So it should certainly be validated. And I think that we've got a bit of an iceberg floating around at the moment in terms of that aspect. So does it support existing pathways? I'm sure you won't be able to read this at the back. This is an example. So I just picked at random one pathway from NICE, it's for chronic kidney disease. Actually, going to existing pathways in the area you're trying to address is quite a good way to look at where all the scope for mHealth is and design your functionality around that. So in this example, it could be everything from the supply chain, the patient information, supporting the patient, treating safely at home in case of something like peritoneal dialysis. So I think if you go for working with existing pathways, you'll certainly get a lot more clinician buy-in. Here's an example that's been mentioned this morning of designing for success. The reason I think Flow, which is at Stoke-on-Trent CCG, has been successful is partly because of simplicity. It's really simple. It uses the most basic mobile phones, SMS only, sometimes in conjunction with a cheap diagnostic device like a pulse ox or a BPM. And it's also so simple for the patients and clinicians to understand. They don't need a lot of training. They are getting useful data back. And they created a friendly persona, so that the branding was very good, I think, with Flow. So that's a good example there. Now, only at this stage, you know, once we've got our functional design, you know, we've mapped out the whole business plan, we've got our functional design together, should we really be thinking about the technology platforms? So rather than getting hung up about, you know, is it Apple, is it Samsung, that's really for much later in the day. We might have seen a nice app, okay, well, is it something that we can use? It's valid to consider those options here, but not any sooner. And I do tend to see people who get hung up on one type of technology because they love Apple or whatever it might be, and therefore they think everyone in the world, well, they won't. You know, it's a consumer business, it's a fashion business, mobile. They won't all switch to whatever platform you think they should be using. So it's better to design for universality. And you have to weigh up, can I buy something in, or do I need to build it for myself? Argues both ways. Sometimes it can be quite good to build in-house. Pros and cons to consider there. Here you get a lot more control, you can build it exactly the way you want it, you can control the intellectual property, but it may take longer to get to market, and you may not have the right image, depending on who you are. If you're a drugs company, say, that may be tricky. If the NHS start building apps, I'm not sure they would always be seen as a leader in that sense, although they've done a pretty good job in Stoke. But here's an example of a guy who did go the in-house route, and it worked out very well. I don't know how many of you heard of Shahid Ali. He's a GP who runs a practice up in Bradford. So if you've heard of the work in Airedale, they've done a lot of pioneering work on telehealth there. But he actually started his work on integrated care planning some years ago. And he looked around, because he initially did it on paper. Then he found, he was trying to find a software-based approach that would integrate with his electronic health records. I think System 1 they use. Couldn't find anything, didn't see anything that was really suitable for helping GPs, and actually formed his own software company, which has been pretty successful. And they built this system called Vitricare, and that's a picture of it in action, as you can see. So it can make sense if you want something that's really optimised. And lastly, don't forget that it's always a good idea to build in the measurements and a roadmap, an evolution cycle right from the outset. Again, where this seems obvious, but quite often people forget about this piece. They do the program and they say, well, we should go and measure it now, we should evaluate it. Whereas if you build that in from the outset, you can probably build some hooks, some automatic data collection points into the service you're deploying that will make this part very, very easy. There's a lot of ways you can collect the data, and sometimes you need to be quite creative. But in this case, I'm not going to give you a named case study of how to do it. I'm going to give you a negative case study of a project. It was also in Africa, but I can't name names. Because what happened was, the initial deployment cost X, they forgot to build in the measurement piece and the evaluation piece, and then it came along later, and the evaluation then cost 5X, which I think is pretty ridiculous. Whereas if it had been built in up front, then it obviously would have been a lot more economical and probably more efficient.